Live stream is good and we are all set to start whenever you guys are ready.
All right. Good morning and happy tax day. It's in case anybody did not realize that, as I was going to drop off something in the mail today. I was reminded it's not April 15th, it's April 18th this year. So what a good day. I just want to welcome you and thank you all for participating. I'm going to go ahead and open up our session today to give you some overviews of some initiatives that are going on within the state at a KDHE level. Hopefully everybody was able to receive their flyer on our upcoming educational series. I'm really super excited about this opportunity to connect with providers. You know, KDHE licenses approximately 4,500 facilities. So this series that we're going to start and that we're going to start offering quarterly is an opportunity to really engage providers and anybody in our regulated community on a level that's more of a systems level, what you guys are currently working and doing every day when you guys come to sit. Our first educational series is really going to be looking at the licensing landscape and who are our partners. So just realizing that it's not a partnership between KDHE and the provider. It also includes our surveyors and our consumers, which are our parents and guardians. So really looking forward to that opportunity. We will have our first session is Monday, and we're going to offer it on Monday, Thursday, and Saturday. So providers have an opportunity to engage in 3 different sessions during that week, if one does not work for them. Really also hoping to then have it recorded. And then if anybody cannot participate, then we'll put it on hopefully there will be a link on our website, and also will include the PowerPoint presentation. Of course, we want everybody to join so that they can be a part of that enriching conversation, but we also understand it's that time of the year, everybody's busy. And then the next one will be in July, and then following that, we will have our next quarter. I'm losing my dates, whether it's January or December. I think it's January. So October and then January. I was a social worker by trade, and it was the least amount of math I could have to do. So even trying to figure out quarterly is challenging to me. I see some people smiling because then they are math challenged also. So they appreciate my pain. Also wanted to share that KDHE is knee deep in a regulation review. Even though the CIT team does traditionally take time off in the summer, we are going to start engaging you guys during that time. And you are our perfect group to start working with. We are looking at regulations in different categories and how we tackle them moving forward. KDHE very much acknowledges and believes that, you know, some of our regulations are outdated. If you look at our center regulations, some of them are 30 years old. The system has modernized. Best practice initiatives of how we engage staff, how we engage children, have updated and evolved. So this is an opportunity for KDHE to continue that conversation and move these regulations forward. So I just always share that with you guys so that you know that when we come knocking at your door, why we want your input. You are our stakeholders. You are also a conduit to parents and other stakeholders who we want to be a part of this process. So just be very well aware of what that looks like moving forward, because I'm super excited to engage you and get your feedback, and can't wait for this process to continue to move forward. Also wanted to talk to you guys about the small center pilots. KDHE, always proud of our innovation, and had a webinar last week where we really specifically engaged and targeted participants for the small center pilots. And very disappointing. I will share the first webinar. We only had 2 people join, but they were very excited and they could see the vision of the small center. And then quickly, I have 2 more people who want to participate. And I see where the small center pilot is going to offer an opportunity for Kansas to make sure that we have facilities that aren't only innovative in their use of space, but they're sustainable. I'm not sure if Kelly is on with Childcare Where this morning, but last week she shared very timely with us an article and a snippet that she had received that prior to 2019, there was a movement across the nation where we saw facilities that were serving between 13 and 25 kids, they were closing. The sustainability wasn't there. So it really speaks to that you need to engage these facilities in a non-traditional center format. And that's exactly what we're doing. We're still providing some of the guardrails of a center with qualifications, training, supervision. We're not throwing out the requirements for you have to have an outdoor play area and all of that. But when you really look at the inside, it's meeting families where they need to be. It's really engaging your use of space and allowing for facilities to serve children, again, from 13 to 23 in their total capacity, but together. If anybody's ever been to a group daycare home, or even a licensed home, it's really that on steroids. It's really having everybody together, but still meeting basic capacity requirements that we're going to set forth, but it's a reuse of space. We have a facility in Wichita that really has embraced this, and it feels very punitive for KDHE to say, you're not meeting your terms of license. But how do we engage them and keep that? Because they never want any more than 23, but they have such a passion for serving toddlers along with older preschooler age children. And they're doing it in a way that is inclusive and really just what families want. It's just a different way of care. And they're able to sustain because they are able to have their staff ratio in a different manner. So I am I know I've used this word several times this morning, excited, but the possibilities are endless. The person at a potential facility that we met with last week, they were just gonna to shelf their idea. They could not make what they wanted to do work. And his exact words are, this will be revolutionary. And they are moving forward with a proposal with the accelerator grant. And they are going to make it work with a capacity of 23. So I am very hopeful that following this pilot, we will have a new category of care in Kansas that will be sustainable for our rural communities and offer families a different venue and opportunity. So we will be doing another round of a webinar with our potential pilot participants this week. And I'm hoping by the end, we have 10 applicants that want to get on this journey with us. So appreciate, I know Riva is probably on here today, and our surveyors who have funneled participants to us, because I really do think this will be revolutionary for the state of Kansas and our rural communities. Any questions about the small center pilot? Okay, also just wanted to give a quick shout out that it has been such a privilege to, from what I hear from our surveyors, to really see the out of the box opportunities that the accelerator grant has has moved forward. I see Natalie on screen, and I just wanted to give a shout out to Natalie. I met with her and the Riley County surveying team. And Natalie, what she is proposing for her community through the Accelerator Grant and getting on board with their early childhood task force is just amazing and should be acknowledged. Because there's many more Natalies that we've shared, but I just have her on my screen right now, and so she's popping up. That what is happening and the trajectory of opening up slots is not in a traditional manner. Again, with a small center pilot. And Natalie, I won't share every bit of your plan, but looking at a multiplex of home facilities that also serves as a teaching springboard for providers is just such a really, really great idea. And also see Amanda on my screen and what the schools are doing to meet the needs of their school districts. Emporia, for example, just sent in 5 applications to KDHE. They are opening up a group daycare home in every one of their schools for their staff. So when you think about the translation to new slots that will open up in the community daycares, just by taking care of staff children is really meeting a need that was unintended. And this is just one example. We have many Southwest school districts that have been following this lead. And what I really appreciate about these school districts is they are taking the initiative and they are valuing childcare. When you see them, because they are rooms that include bathrooms and sinks, and they're giving them, we're looking at what does that play area look like? And that's how we're going to continue to move forward this conversation of, because I don't even want to say this is an out of the box need. This is just truly a community doing their own work. And so appreciate Natalie and then all of the school districts that are moving forward with Amanda appropriately funneling them to licensing. I just think there's really a lot to celebrate that is going on in Kansas. And I know our last meeting was pretty heavy in the content and all of the things that may happen. But I'm a firm believer that we will come out of this a better program and a better opportunities for the kids in Kansas, because that's really what it's about. It's about the consumer, and it's our most protecting our most vulnerable population. So I just appreciate all of the work that is going on, and I really wanted to take a minute to celebrate that. And can't wait to see the final accelerator grants and everything that is going to happen in our communities and all of the good work that is happening because of valuing childcare. Not just we're going to put kids in we're going to take down the qualifications and we're going to limit the space. But all of these good things are happening under current regulations where children are being valued. So that's all I have on my soapbox this morning. And I'm going to hand it over to Megan. And I just want to say thank you. And if anybody wants to come off mute and share what they've been doing at a local level and all the progress that they've made or anything that they're super excited about, I want to give you an opportunity before we start going into our work groups.
All right. Good morning, everyone. Thanks for those updates, Melissa. This is really our time for any member bright spots, updates. If you do want to share anything you're working on for the accelerator or other opportunities you're excited about, we'll take a few minutes to do that.
I'll share. In City of Wichita, Sedgwick County in March, We did our big Super Saturday training where we had 103 providers get 6 hours of KDHE approved training. Due to scheduling and family, instead of the surveyors doing the training, we reached out to our program directors, and we had several volunteer to come in and train their peers for the day. We had vendors set up, and the only thing we asked our vendors to do was supply door prizes. And we ended up having 39 door prizes between, I think we had 16 vendors. So they really came out in support of our providers and gave some pretty great gift cards, things to use in their program. Got a lot of positive feedback on the training. So that was great. And then today, the city of Wichita did the proclamation for the Week of the Young Child.
Oh, that's really exciting. Thanks for sharing that, Adrian.
Thank you.
That is amazing, Adrian. I love the collaboration and what you guys are doing. I mean, if no one's not been paying attention to Wichita, they're just rocking it out there with their partners, with not just Adrian and the surveyors, but Child Start and everything. And can I just do, is Tanya Bullock on today? I want to make sure she is. If she's,
I
if
don't
she's
think
not
she is on today.
Okay, I still want to share. She was one of our Wichita highlighted not employers, but I think it was like the Wichita 40 under 40 and staff that are doing amazing things. And Tanya Bullock was one of those that were recognized in Wichita, and such an advocate for what she does with the resource and referral and personally. And so we will have to share that with her. But I was shared that article, and she just moved into her executive director position. So it is such a treat to have her as a part of our systems improvement team and all that she's doing. And Adrian, when does the city do their final vote on your local ordinance change?
A couple weeks ago, it's passed the city. It's done with the city. We had to take it to the county commission. We took it to the commission and it passed unanimously there. And my understanding is they had to print it or something for feedback. It's actually on my list to follow up with to see if we're good to go now. So it should be very close that we can start doing our group homes in the city limits.
Yeah, so that will potentially open up 600 slots in the city of Wichita. So kudos to all of the great work that Wichita group has continued to do. But Adrian also brought up a good point. Any activities you guys would like to share that you guys have planned for Provider Appreciation Day coming up? I think those are something we should share and celebrate. If anybody has any good community initiatives that they would like to talk about.
Riley County and Potawatomi County is working on a Provider Appreciation Day. It's going to be April 30th at the Liquid Art Winery from 3 to 5. And we have a form for parents or anyone really in the community that want to nominate their provider. And then we'll recognize them at the Provider Appreciation Day. And then if they are nominated, they will also receive a gift card from the Manhattan Apple Bucks through the chamber. And then also get a certificate. So we're making it family friendly. There's going to be lots of activities, art activities, and things for the kiddos to do. They're going to make May Day baskets because the next day is May Day. So I think it's going to be really nice. Natalie's working on that with me. If I missed anything, Natalie.
No, Heather, we're excited about all the agencies in our area all coming together. And yesterday we also looped in Fort Riley, and they're another dynamic community, but an important one. And we're excited. So there's that. And then just to tag on to Wichita, great job with those codes. I was actually able to use that as an example to Manhattan code development. And they are ready to also work through our city codes to make it more, or I guess, less prohibitive to start childcare businesses.
Good job.
So thank you for that.
This Saturday, our Early Childhood Directors Organization and the Early Childhood Providers Organization, they're having what they call the Impact Awards, and it's similar to what Heather was saying. Facilities and home providers are nominated by their families, their coworkers, the community, and so those that are nominated will get their nomination certificate, and then they have what they call a spotlight recipient that their board votes on out of all the nominations. And that's this Saturday at 2:00.
Kind of feel overwhelmed. This is amazing. I good kudos to providers. We need to make sure we share that. And I should share that KDHE will be launching their media campaign, Childcare Matters, in conjunction with or in coordination with Provider Appreciation Day. And Derek, our Bureau Director, is working fast and furiously on all of those media buys. And Derek, did you want to share anything about what we will be doing first with the, I should have warned you, but with the Childcare Matters media campaign?
Nothing set in stone yet, Melissa. Nothing set in stone yet, but we're working with some vendors to roll out, to get the media campaign, statewide, a lot of different mediums. So we're talking to them on that and excited to get it going, making sure that we get some of our documents translated as well into Spanish. And really, different pockets of the state kind of take a different approach, and people are more receptive to certain media, whether it's radio, TV, social media, whatever it is. So trying to be creative and innovative as we roll that out too, because we want to obviously get the best bang for our buck on that, and bring awareness to childcare in Kansas to folks that might be interested. They just need that little bit of a nudge to say, hey, this is a wonderful occupation, a wonderful career. And we're gonna really highlight that with this campaign. So I'm excited to get that rolling, and maybe we'll have a few other things up our sleeves too. So.
And then what I really appreciate about Derek and what he's being mindful of where we roll that out on is we will make sure that if there's a certain area that you're not just sitting in your car one day hearing the radio, that you will understand, because there might if you're getting radio ads, print, just so that if there's something that you want to tag on to, that would be an opportunity, and you're not caught off guard with hey, now I hear this great ad, and what back message can I do in my local community to support that? That's really what we want to see. And then very much mindful of looking at the impact of this campaign to, at the very tail end, did we get more providers because of this? Did we educate the community of what it means to be what it means to have licensed care? And was all of the objectives of the media campaign, were they met? So that's something KDHE will also be mindful of. Okay, any more bright spots anybody would like to share about their agency or their community? Kristen.
Kelly and I are working on some provider appreciation things. We've just made little tags that say thank you for your dedication and hard work. And there's a local cookie shop here that makes honey sugar cookies. I don't know if you've had them or not. They're delicious. And so we're going to have them do that and make a little design, and then some water bottle labels. Just something fun. And then her and I will take a couple days and deliver them personally to each of our providers in the 4-county area. So we're excited about that. Not any community involvement, but that's something that we're gearing up for Provider Appreciation Day.
Those cookies sound really good, Kristen, right now.
They are delicious. We put in some extras for us.
Well, you should be appreciated too. Yes. Anything else before we get into our work group information?
Is that okay if I jump in really quickly, Melissa?
Please do, Sarah.
Okay, great. Well, I have an update around the Child Care Quality Improvement Support System work, CCQIS. We have been able to work very closely with our advisory group that is made up of a few members here today that shared some input around a childcare management software platform that we will be able to start rolling out to providers at no cost to them for the remainder of 2023 and a portion of 2024. And we will start doing that in May. So more to come on that. There will be a lot of information out there. We will be hosting some webinars. We will be offering consultation to go along with this offering. So it is really exciting. We're thrilled to be able to offer providers a way to really strengthen their business practices through this child care management software. So stay tuned.
And Sarah, just in good spirit of partnership as we move forward with our educational series, maybe not next week, because that's really quick, but if you have stuff, please, this is the natural partnership we want to be able to get that information out to providers while we have a captive audience. So keep that in mind.
Perfect. That's great. Thank you.
All right.
Okay.
Any final updates or bright spots before we switch into our recommendations? Okay, well, thank you everyone for sharing. And it's always nice to hear all the great stuff that's happening at the local level. So we're going to stay together. We're not going to break into our work groups today. We're going to do kind of a quick high level overview of the 3 recommendations that the work groups have been working on. We went into them in more detail last time and shared them, and thank you to everybody who submitted any responses via email or in the meeting last time. So after we do the review, we're going to ask for group consensus, and this is really, these are somewhat living documents. We know that things may change as they get implemented, but certainly want to make sure that everybody feels at least comfortable putting them forward. So don't worry if it's not 100% perfect, but certainly if if you don't feel comfortable or you feel like there's a big problem, we want to hear about that. So we'll walk through them one by one, and then after each one, open it up for any questions or discussion, and then we'll do a final consensus at the end after we've gone through each of the 3. So before we do that, I do want to just say thank you to the work groups. I know, I know everybody's busy and sometimes it's not fun to come together and work through these documents and ideas for several months at a time. But I think there's some really solid ideas here, and just kudos to the group for bringing energy and creativity each month and saying, how can we make things a little bit better for providers? So I'm going to start, I will share my screen here, and I'm going to start with the provider supports group. So the recommendation is to develop a toolkit for communities and partners interested in establishing, strengthening, and/or expanding childcare in their area. I think the need and rationale, you can probably imagine, is recognizing that there are a lot of local communities and different partners, sometimes kind of traditional partners, and sometimes people that maybe are newer to the conversation about childcare, trying to come together and better understand how do they solve for childcare. And so this is really the audience that this toolkit would be for, is particularly people that maybe they don't, childcare might be kind of new to them. So helping break down some of those language barriers, and just, I think many of us are familiar with hearing, we know it's a problem, but we're not really sure where to start, or we kind of got stuck, and so we stopped. And so really trying to kind of just demystify all of that a little bit. I think as with, I think, many of our recommendations, it's recommended that this is created collaboratively, recognizing that there are a lot of people in the system and a lot of groups in the system that can help inform this, and also making sure, is the language right? Is it resonating with people in the local level? So, you know, figuring out what that might mean in implementation, but maybe bringing it back to the CCSIT as it's implemented, or even kind of testing it with a few people in the communities and saying, does this make sense to you? Something available digitally, but also that could probably be printer friendly. And I think that probably the biggest thing is making it digestible. And I think the group went back and forth a lot about, you'll see here, there's a pretty lengthy list here of things that can be included, but we felt like it was worthwhile to list all of them, and then you know, task whoever's implementing this with, how do you make this in a digestible format? How do you create it in a way that people can actually find the one or two things they're looking for? But childcare is complex. And so while we want it to be digestible, we also don't want to dilute it to the point that people aren't getting the information they need. So being really mindful of the type of language that's being used, and then also just considering what are different formats so that people aren't getting lost in the weeds. So types of information are about kind of the buildings, models, partnerships, sustainability, a lot around business practices, staffing, that kind of thing. So again, I'm not going to go through all of that. I will flag, I think there are a lot of tools that have already been created within Kansas and even nationally that can be leveraged in this toolkit. And also making sure we're pointing to resources that exist, things like the Go Team, Childcare Aware, all the great supports that are available for childcare. I don't think a toolkit can ever fully replace the human support. So this is like kind of the entry point for people to find the basic information, but then know, you know, sometimes you do need to pick up the phone and who is the best person to do that. All right. Any questions or comments on the recommendation from the provider supports group? Okay. Clayton, I will hand it to you. Do you want to share your screen, or do you want me to share?
I'm happy either way.
Okay, I've got it up, so I can just
Go ahead.
bear with me. So this is the system engagement group.
Yes, so our recommendation was in relation to the facility compliance search on the KDHE webpage. The work group recommended for KDHE childcare licensing to elevate the user friendliness in the facility compliance search process in order to help the public understand and appreciate requirements of being a licensed childcare provider. And then we collated a list of improved recommendations for the webpage. I won't go through the entire thing, but some of these included making sure that all links from external web pages link to the Start Here page, create some how-to guidance in the beginning that could include some information on what's important to know and what's the value of licensed care, and also showing the number of regulations providers follow and the extensive effort that's put into creating safe care environments. Also, some recommendations were to improve the user friendliness of the search feature and also provide some definitions of different types of facilities and what's a complaint survey versus a licensing survey, etc. The rationale for this was that this recommendation would educate consumers on the importance of licensing and the intensive process that licensed providers undergo to ensure safe environments, and also to hopefully impact childcare providers by showing the amount of work that it takes to go through the license process and the effort that these providers put into the quality of their care. Additional considerations that we added was just to ensure alignment with other consumer resources like KQN, Child Care Aware, the All In for Kansas Kids website, and so on. So that's just a brief overview of the recommendation. I went in more detail and showed some of the actual facility compliance search process in our last meeting, but happy to take any questions. Also, great job to my team. Very proud of the effort we did.
Okay, thanks, Clayton. All right, Melissa, I can share the regulatory groups.
Okay, our group really focused in on an interpretive guide. We all recognize that regulation writing is a special skill set, and interpreting it sometimes is a special skill set. And it is written in a way that we try to make sure that it's in plain language. But again, KDHE actually has a manual for regulation writing that's very thick. And I appreciate the reg writers so much in a different level than ever before. So similar to other states, recognize that maybe it would be, not maybe, that it would be helpful for the program to start looking at an adoption of an interpretive guide. Some way to translate to a provider what we're actually looking for and how that regulation is implied in their facility or in their program type. So looked at other states, and other states are there's a wide variety of interpretive guides out there, to very simple guides to the whole, this is what the licensing process does. This is what your survey. So it's, it's very much an expansion on just the regulations. So our group really wanted to look at a simplified interpretive guide, and really beginning with home regulations. Because we do have the framework to begin that within the context that surveyors have a guide that we provide them, some information, especially if you're new to the field. So we have the framework to begin looking at this. And we're going to move forward with that, really focusing on what is our newest set of regulations, which is our home regulations, our licensed home and group daycare home program types. But keeping in mind that we have a pretty aggressive timeline for a regulation review that may curtail. I just wanted to be very transparent with the group. That our priority would always be, we could put out a product, but knowing that it's I always say our products are living, meaning that they can be updated and changed and modified at any time. There's really nothing that is a lockdown component in CCL's world, because we need to update, and we should. We need to be mindful of any changes. So we will start with the home guide, and then we will move forward and update as needed. But really feel like that would be a good launching pad, because those regulations, again, are the newest and have the most updated language to them. So if we did do a regulation review, there's not a lot of work that KDHE would have to do to that particular set of regulations. And then we will tag on to a lot of Clayton's initiatives with making sure that any of our documents in his work group are updated on our side, because we had some dual recommendations of looking at some of our also looking at, do our brochures, are they also written in a common language to share with providers? And are they written in a language that consumers can also review on what happens on an annual and a complaint survey? So it was as we're looking at our final recommendations, it's always really good to know we're on the right path because so many work groups have the same ideas, or at least the base premise, and then we flesh them out a little bit differently. And that's it, Megan, for our group.
All right, any questions or comments for the regulatory group or really any of them? Okay. Well, again, we won't do a formal vote. We do group consensus in this group. So I will ask if anybody does not feel comfortable supporting the group putting these forward, to just call that out either in the chat or coming off mute. We really want to make sure that the majority of the group feels comfortable officially handing this off to childcare licensing for next steps. So do a final call for any concerns, and if we're not hearing them, then we will take that as you feel comfortable moving it forward. Okay, the group feels good.
I think
All right,
it
I'm
does,
seeing lots of
Megan.
head nods. Great. Well, again, thank you all. I know this is usually a multi-month process to just kind of get through the conversation, and I'm very excited and proud of these recommendations. I think these are all very good things for the system, and as with our previous recommendations, once they get handed off to childcare licensing, we'll continue to keep you posted on how things are going and how they evolve. You know, we heard about the childcare licensing awareness campaign. That was a recommendation that came out of this group. So it's a very good feeling to know that hopefully in a few months we can come back with some of these and say, look, you put this idea forth and it's actually coming to life. So you know, each month the conversations really lead to actual change in the system, and I hope you all feel as proud of that as we do as leaders of this group, because it's really exciting, and I think it's meaningful change for providers and for families. So give yourselves a little high five or a pat on the back or whatever, because this is really good work. So thank you all. That's really, we have had a shorter agenda today. Figured everybody would be happy to take a little time back in their day, but Melissa, is there anything else you want to add or anybody else before we close out?
I just want to say thank you again. KDHE values your thought process and your opinions, and really truly when Megan and I review over the last several years what has come out of CIT and the conversations and the recommendations, I'm just always very proud to be a part of this group. And so from a KDHE perspective, I just wanted to say thank you, and very excited that we could give you back. It's now 44 minutes of your day, because that doesn't happen very rarely anymore. So yes, enjoy this rest of this spring day, and take your allergy medicine if you need it. It's a high pollen day, people.
Absolutely. Thank you all. Our next meeting will be May 16th. So we will see you then, but enjoy the rest of your Tuesday and the rest of your week.